The amended version of Governor Ivey's safer at home order goes into effect today, and it is bringing big changes. Here's what it means for you. Non-work gatherings of more than 10 people now permitted as long as social distancing is practiced. More food options are now out there. Restaurants, bars will be open with limited seating. Gyms, close contact services can also open. They are subject to social distancing and, of course, sanitation rules and guidelines. The governor knows reopening is a bit risky. She sends this warning to all of us.
The threat of COVID-19 continues to exist. It is truly deadly, and it must be addressed.
But there are some things that will remain the same under that safer at home order. Retail stores will remain open at 50% occupancy. Entertainment venues and schools will not be allowed to open just yet. And hospitals and nursing homes will continue to restrict visits. But despite those changes, you are still urged to stay at home. And now we know the first thing that a lot of you will want to do, especially Rick, is get a haircut. There are some new guidelines that workers have to follow. Each worker will need a mask or a face covering. They will have to wash their hands before and after each client, and gloves must also be worn as well.
Well, the state school superintendent now giving the green light to hold in-person graduation ceremonies. They must be kept 6 feet between both students and families. Dr. Eric Mackey says some schools are looking for bigger venues to hold their ceremonies. As for high school sports, the HSAA says they will not start until at least June 8th. Over at Anniston, all public parks will reopen at 8 o'clock this morning. Of course, social distancing. Again, that's the big phrase there. It applies here as well. All playground equipment and other outdoor recreational venues like tennis and basketball courts will remain closed.
And you might be asking yourself why portions of the parks remain off limits. Well, here's why. That's because coronavirus can last on the plastic for up to 72 hours. And on playgrounds, that means the slides and the swings are not safe. It also includes some of that sporting equipment. Now, if you do plan on getting out for some retail therapy today, UAB wants to make sure that you know how to shop safely. Now, some stores are making it mandatory that you wear a mask or a face covering. UAB is urging that you follow those rules. Try to shop when it's less crowded and try to only pick up what you intend on buying.
As we mentioned, Alabama begins reopening today as it stares at 10,000 cases of COVID-19. It could hit that mark today. Here's a look at the new cases confirmed over the last week. For the month of May, the state averaging now about 283 new cases a day. That is much higher than our April average of 202. Also of concern now, 3 of our hardest hit days since the outbreak have been in the past 10 days. May 5th, 331, May 8th, 338, and the worst day to date, May 7th, 353 new COVID-19 cases. More than 128,000 tests have been completed in our state. It comes out to a 7.7% positive rate. That number now down since April 18th, when nearly 10% of all tests yielded a positive result.
And our time right now is 4:04, and nearly every state in the country has reopened to some degree, some less than others, and less than 10 remain shut down. Now, 2 others plan to reopen soon. As more people are out and about, more people are expected to not only contract the virus, but unfortunately also die from it.
Simply put, the rise in mobility, and that's the key driver. We're seeing in some states, a 20 percentage point increase in just 10 days in mobility. And that will translate into more human contact, more transmission.
Well, cell phone data shows the increased mobility mostly in states with relaxed social distancing. So if more cases are being reported and the deaths are expected to rise, why are so many states reopening?
We can't stay locked down for 18 months. But at the same time, when you have cases increasing, deaths increasing, healthcare workers without adequate protective equipment, and we're suddenly going back to what was once our normal lives, that's not a safe place to be. We can't do that and not expect to see a major increase in cases.
Here's where we stand this morning as a country. Big picture here. More than 1.3 million cases now confirmed. Besides a spike May 1st, for the most part, new cases have been held steady. Here in the U.S., more than 216,000 people have recovered. In fact, the recovery rate up over 16% now. Right at 9 million people have tested in the U.S., about 2.7% of the U.S. population. Well, Vice President Mike Pence plans on being at the White House today despite his press secretary testing positive for the virus. The VP has tested negative. He's following doctors' guidance. No word on if Vice President Pence will be at this afternoon's press briefing of the Rose Garden. President Trump is expected to address testing.
And our time right now is 4:06, and the Trump administration is predicting Depression-era unemployment numbers for this month. Now, right now, it's just shy of 15%. Unemployment reached 25% at the height of the Great Depression in 1933. Treasury Secretary Steve Mnuchin says with half the economy closed, this was expected.
This is no fault of American business. This is no fault of American workers. This is a result of a virus. And that's why the president and I were determined to put together the largest economic program ever to help American workers get through this.
A record 400,000 Alabamians have applied for job loss benefits during this outbreak, and nearly 29,000 claims were filed just last week, and more than 10% of those were here in Jefferson County. Now, unemployment in the U.S. has not seen double digits since 1940.
Worldwide cases now surging past 4.1 million, a third of those found in our country. The next closest country, Spain, with 224,000. For the first time since April 3rd, the city of Wuhan, China, now reporting its first new case. That patient in critical condition, wife also testing positive as an asymptomatic case. The health commission there says the cause is past community infection.
And back here in Alabama, testing in Hueytown is now widely available. Stopwatch Urgent Care Center is testing everyone, even if they're not showing any symptoms. A nasal swab is going to be used for that testing. It usually takes 48 hours to get results. The testing is made possible in part due to a wealth of supplies.
We finally hooked up with a company that's able to get us all the testing that we need, and right now we're able to test anybody that wants to come in and get tested.
Now, that testing will be held Monday through Friday from 8:30 to 6:30. On the weekends, the hours are 9:30 to 4:30. Walk-ins are accepted, but you're asked to register online at stopwatchurgentcare.com. Our time right now is 4:08, and a Central Alabama woman is using a newly discovered skill to help others. Darlena Battle learned how to sew, and now she's making communicator masks. She says that someone whose son is hard of hearing reached out to her. Now, Battle says after posting that mask on social media, requests for more of them started rolling in.
She told me, she said, when I got the mask, I talked to my son and he was able to repeat everything that I said. And that's because he was able to read her lips.
Now, Battle says she now has more than 50 requests for all of her masks. She's started a Facebook page for anyone who's interested. You can just search BHAM Communicator Face Mask.